Hi friends, welcome back to my channel. In this video, we are going to discuss about disorders of purine catabolism. If you are new to this channel, please press the subscribe button and click on the bell icon to get notified. So what are the disorders of purine catabolism? The catabolism of purines, that is the adenine and guanine, produces uric acid. At physiological pH, the uric acid mostly ionized and present in plasma as the sodium urate. The elevated serum urate concentration is known as the hyperuricemia, and the uric acid and urate are relatively insoluble molecules which readily precipitate out into the aqueous solution such as urine or in the synovial fluid. And the consequence of this condition is called as the gout. The average normal blood serum level of uric acid is around 4 to 7 milligram per 100 ml. So that is the normal range. So in case of hyperuricemia, the levels will go up from the normal range. So what is gout? Gout is a metabolic disorder associated with elevated level of uric acid in the serum. And the increased uric acid is due to either increased formation of uric acid or its decreased renal excretion. So it can be of two reasons. One is overproduction or increased formation of uric acid, or the decreased renal excretion. So whatever the cause may be, the gout is associated with hyperuricemia, but hyperuricemia is not always associated with gout. So whenever there is a hyperuricemia, it is associated with gout, but hyperuricemia is not as always associated with gout. Coming to the classification of gout, gout is classified into two broad types, that is primary gout and the secondary gout. The primary gout is an inborn error of metabolism due to overproduction of uric acid. And in primary gout, increased level of uric acid is associated with increased synthesis of purine nucleotides. The increased synthesis of purine nucleotides is caused by defective enzymes of purine nucleotide biosynthesis. So these include PRPP synthetase, PRPP glutamyl aminotransferase, GPRTase, glucose 6-phosphate. So any defect in these enzymes can result in the increased synthesis of purine nucleotides. So in the normal cases, PRPP synthetase and the PRPP glutamyl aminotransferase are allosterically fed back regulated by its own product AMP and GMP. But due to loss of allosteric feedback regulation, abnormally high levels of PRPP synthetase and PRPP glutamyl aminotransferase result in excessive production of PRPP. So this result in accelerates the rate of de novo synthesis of purine nucleotides, and increased synthesis is associated with increased breakdown of uric acid. So that's how the level of uric acid goes up due to the defect. When there is a defect in GPRTase, the enzyme GRPTase catalyzes the synthesis of GMP and IMP. Then the deficiency of this enzyme lead to reduced synthesis of IMP and GMP by the salvage pathway, and this increases the level of PRPP, and increased level of PRPP accelerates the purine nucleotide biosynthesis by the de novo pathway. So these all are related. And when there is a deficiency in glucose 6-phosphatase, the enzyme is not directly involved in the purine synthesis, but it is involved indirectly with biosynthesis of purine nucleotides. So what are the symptoms of primary gout? So patient with primary gout shows deposition of urate in toffee, that is the clusters of urate crystals in soft tissues, and that affects the joints, and that leads to painful arthritis. The kidneys are also affected since the urate is also deposited in the kidney tubules, and this leads to renal failure. Coming to the secondary gout, the secondary gout results from variety of diseases that cause elevated destruction of cells or decreased elimination of uric acid. The elevated destruction of cells is accompanied by increased degradation of nucleic acid to uric acid, and which occurs in cases of cancers like leukemia and polycythemia, and other disease conditions like psoriasis and hypercatabolic states. The decreased elimination of uric acid occurs in chronic renal failure due to reduction of glomerular filtration rate. So all these are the causes for the secondary gout. So how gout can be treated? Gout can be treated by a combination of nutritional therapy and drug therapy. Especially controlling the food also can help in reducing the symptoms. Foods especially rich in nucleotides and nucleic acids such as liver or coffee and tea, which contain purines, caffeines and theobromine, are withheld from the diet. Restriction in intake of alcohol is also advised in many cases. So this is how the treatment can help reduce the symptoms of gout. So hope you are clear with this topic. If you like the video, please press the like button and share it with your friends. Thank you.